In 1997, 3 community hospitals merged. They were Northwestern General, Humber Memorial, and York Finch General Hospital. And they became Humber River Regional Hospital. When we looked at the plans that were on the table for the 3 facilities, we didn't feel it was going to be adequate to serve the needs in the long term. We came up with the plan that we would change the model of care because the model of care across the province had changed, and that we needed to provide most of the services out in the community while the acute care services were centralized. The new Humber River Hospital, located at Keele and 401, is going to be at the center of the care that we're going to provide for the community.
The hospital is 1.8 million square feet. It's 656 inpatient beds, and then all the other services you would want. So we provide all services except open heart surgery and neurosurgery. It's built on a part of a campus that's a Government Ontario campus at Keele and Wilson. It was called the Ministry of Transportation site, and we have almost 30 acres that we're building on, and the hospital will be 14 floors high and about the size of 2.5 football fields on the base levels. 30 of the acres, the whole area that the hospital is being built on, was parking lot. So we looked at it as an opportunity to work with the campus, reorganize the campus, beautify the buildings that existed, and create a beautiful community amenity.
There were a lot of discussions that occurred in the planning phase to determine what healthcare of the future would look like. Part of our strategic plan looks at patient and family-centered care.
We also wanted to create a workplace of distinction. And in creating a workplace of distinction, it has to be an environment that your staff are comfortable working in, your physicians are comfortable working in.
And we came down on 3 areas for the new hospital of being lean, green, and digital.
Lean is one that we started planning long before we even had approval for the hospital. But we realized that in small, old buildings, I don't have to walk very far to deliver care and find things. When you start to look at modern building design, you're talking about a much longer walk. You can't ask somebody to be happy at work, be able to see their patients and enjoy what they're doing if you're doubling the amount of time they have to walk. We asked the designers and the builders to take this into consideration as they designed our building, to bring us some really unique ideas about how to decrease the amount of walking time, how to get sunlight into these big units, how to be sure that the patients had a relaxing and quiet environment to be in. And one of the things they did was they located staff elevators and supply closets and supply elevators quite frequently throughout the unit within the center of that 32-bed unit. So a nurse doesn't have to walk any further than 6 beds away to try to find the supplies she needs. In terms of our patients, we knew from a new way that Ontario is building hospitals that 80% of our patients would have a single patient room. So when you start to have a single patient room with a 3-piece bathroom in it for the individual patient, you are able then to create some space for the family to stay over, and you start to welcome the family into the room.
We did take into consideration how we would be a partner in the community. A lot of our design is about that, about creating a facility, although large, that fits into the community. So part of our strategy is being green. Green not only means energy efficient, it means that we're using green roofs, but a lot of green around the building as well. And so that there are bike paths, walking paths, places to sit.
Lots of trees, healing gardens, gathering places for people to sit. We've tried to be respectful of some of the designs and furniture in the community and create some nice sitting areas and green walking paths for people.
A digital hospital means that every process within the facility is fully automated. Patients from home would be able to access their health record. They would be able to look at when their future appointment is and show them the location within the facility to go to. The supplies within the hospital will be delivered straight to the unit by robots, saving time for the people who are trying to provide the care.
Our digital vision has really focused on how am I connecting with my patient. There is not only a screen at the bedside for the patient to use, but also a monitor at the foot of the patient's bed, and both of those devices will have on it their email, their TV, video, internet connection, but it will also have access to their chart. It will have learning videos on it. It will allow, just by virtue of me walking in the room, my picture to come up and the person will know who comes in the room. These devices will help people to feel like they're not isolated. They can have Skype with their family. They can communicate any way they want on these devices. Our entrance for ambulatory care is called Portals of Care, and we fashioned it very much after an airport design. When a person drives up, they'll be able to drop off right at the entryway for the type of treatment they're coming for. It'll be clearly labeled. Their information will tell them which door to come to. They'll walk 30 feet across a beautiful entryway and go straight into their clinic appointment. It's a bit of lean processing that we did for our patients. We didn't want them to have to walk a great distance. We wanted it to be close and easy access for them. The first 5 floors, which are the podiums we call them, which is where the operating rooms are, many of the ambulatory services from floor 6 to 14 will be our inpatient beds. The patient care tower is largely glass, and that's of course to allow windows for our patients to be able to look out of. So it's largely glass, but there is also some brick and some precast concrete, trying to give it more of a community look and not just a great big tall glass building. We have what we call the main alley, and what it is a almost 3-height lobby entrance that is the full length of the building, and it will allow you to look to either end where there are elevators that can take you up into the building. It will also have a staircase that will take you up just 1 flight of stairs for people that want to easily get up to the diagnostic imaging or the operating room, and 1 floor downstairs to our food court and an outdoor patio area. The staff areas and the place that our automated guided vehicles will deliver product and things will be coming and going are internal to the nursing units. So in fact, as you come as a visitor, it's a very peaceful environment that you, as the public, are traveling in. You're not seeing carts being pushed through there, you're not seeing product being delivered, you're not seeing linen being delivered. All of that is being done internal to the building on the nursing units. The public area, it really has a more peaceful, more quiet environment for people to come and go from.
One of our sites at Finch and 400 is going to be ambulatory care. The church site and the Kiel site will be decommissioned and will not be used for acute care and are not part of our future model of care.
Over a 30-year period, with the maintenance and the fees that must be paid, the total project cost is $2.6 billion. When people talk about the cost of a building, they talk about the cost of construction. They talk about the cost of maintaining it over 30 years. So when you hear very large dollars for these DBFM projects, these design, build, finance, maintain projects, it's because you're talking about not only the cost of the construction of the building, but you're also talking about the cost of maintaining it over the 30 years.
We have the opportunity to build new, and we wanted to make sure that we were able to use as much of what's going to happen in the future in our plans. And that's how we came about with looking at technology, but also trying to set a benchmark for what other people can use in their current facilities and what other people should think about if they're building a new facility.